Hello everyone, I'm Dr. Jong from Lih-Ren Clinic. People have many problems in their lower eyelid. This problem is not a problem for mid-age or elderly people. Young people has this problem too. In this video, I'm going to introduce you what is spiral, begging eyelid, tear trough, middle cheek groove, apple cheek, and the way to treat this problem. Firstly, I introduce an important concept. That is the beautiful curve of the lower eyelid. Let us take a look from the side on the current beauty 治愈皱. What does the young and the beautiful lower eyelid look like? There will be a slight convex curve at the top. We call it spiral. Spiral is a muscle tissue. There is a slight concave under spiral. Further down to the cheek will be a smooth slight convex arc. Begging eyelid, tear trough, and the Midcheek groove destroy this beautiful curve, so that lower eyelid is not beautiful as it will be. Spiral is a muscle tissue. When lifting, spiral will become more obvious. Basically, spiral gives people the feeling of being young, friendly, and smile face. We do not have to treat spiral. In this picture, it is easy to point out where the begging eyelid is. Begging eyelid is caused by the bulging fat. We call the depression under the begging eyelid is tear trough. The tear seems to flowing down in the tear trough. Next, I introduce the apple cheek. Apple cheek should be convex and full. Apple cheek depression refers to the depression at the junction of lower eyelid and the cheek. People with apple cheek depression usually combine with Midcheek groove. Midcheek groove means the depression at the junction of cheek and the cheekbone, and go downward obliquely. Begging eyelid, tear trough, apple cheek depression, and the Midcheek groove destroy beautiful curve. The principle of plastic surgery is to improve this irregularity and restore the beautiful curve of lower eyelid. Then I will introduce the treatment of this problem. Speaking of begging eyelid, many people think of removing the fat from the begging eyelid. This is a diagram of removing fat to treat begging eyelid. The bulging fat is removed. This is a case of removing fat to treat begging eyelid. This method is suitable for the patient with only begging eyelid but no tear trough before surgery. The beautiful curve can be restored after the operation. Some people only have tear trough but no begging eyelid. For this patient, my suggestion is to inject hyaluronic acid to fill the tear trough. If they are associated with apple cheek depression or Midcheek groove, they can also be filled at the same time. This is a diagram to show how hyaluronic acid fills the tear trough. Hyaluronic acid improves the depression caused by the tear trough. This is a case of filling the tear trough with hyaluronic acid. After filling, the beautiful curve of lower eyelid was restored. This is another case of tear trough filling with hyaluronic acid. Many people ask me, isn't the effect of hyaluronic acid short-lived? By my personal experience, the hyaluronic acid injected in the tear trough can often last for more than years, so that it is a simple and effective method. The third situation is also the most common situation. Begging eyelid combined with tear trough. The best surgical method to improve this kind of irregularity is to reposition the begging fat down to fill the tear trough depression. After the operation, the begging eyelid becomes smaller and the tear trough becomes shallower. It's a way to kill two birds with one stone. This is a diagram showing fat reposition to tear trough. After the operation, the begging eyelid becomes smaller and the tear trough becomes shallower. This is a case of fat reposition to tear trough. Beautiful curve was restored after operation. This is another case. Many patients concerned with the operation deep scar and where the recovery belongs. When the skin of the lower eyelid is not loosened, I often use transconjunctival approach to perform the fat reposition. Because the wound is made in the conjunctiva, there will be no scar be seen. The recovery from the operation is quick, like the representative case. The upper left is before surgery, the upper right is the day after surgery. The lower left is 1 week later, the lower right is 3 months later. Swelling and bruising was less and the result was good. Finally, this table is the summary. For those with begging eyelid but no tear trough, I recommend fat removal operations. For those who have no begging eyelid but have tear trough, hyaluronic acid injection to fill tear trough is recommended. For those who have begging eyelid and the tear trough, the best way is fat reposition operations. If you have no begging eyelid and no tear trough, congratulations. Is it too complicated for you to be understood? If you have this problem in your lower eyelid, you can consult an experienced plastic surgeon to evaluate for you. Choose the method that is suitable for you to restore the beautiful curve of lower eyelid. Thank you for your watching.